You should be good.
Good morning, everyone. We're gonna go ahead and get kicked off. Welcome to Texas A&M Commerce Dallas Metro Play. I'm Dr. Shane Creel, and I'll be the moderator for the panel discussion. But before we get to that point, though, I'd like to call Dr. Rashara to give some opening remarks.
I'm gonna clap for me.
Hey guys, my name is Dr. Elizabeth Bashir, or Dr. E. I have students in the room. I have future colleagues that I'll be connecting with in the room. But I officially want to welcome you to A&M Commerce Dallas. This is where we are. And I've met some of you all already that didn't know we were here. So let it known, we're here and we're staying as long as we can make it happen, right? So thank you for saying yes to the email. Thank you, students, for honoring the syllabus. Appreciate y'all. We have some people on Zoom. Thank you for joining in on Zoom. And this is our first event. This is the very first time we're doing this. So it's an inaugural event. And we're hoping this will be something we do frequently. So during the sessions, the panel session, the networking, we're there to network. You know, we didn't want to do too much at the beginning, right? Because we want to read the room, read the turf. After the day, we will be having a QR code with a feedback form. So please put in any feedback, what you would like to see the next time. Because we're public health professionals, right? We do a needs assessment to be able to meet the needs of the community we serve. So we delivered something that we want to definitely make sure it's created to meet the needs of our students. Students, can y'all raise your hands? So we have a lot of students in the room. So for our professionals, if you're looking for interns, if you're looking for employees, this is a place to be. Come talk to me and I'll tell you all of them are good. But without further ado, I want to hand over the mic to one of our Dallas County Health and Human Services representatives. We are in Dallas County, so it's just fitting to have somebody from Dallas County to just give a few words. And I just met her 5 minutes ago, but that's the power of networking, right? You shoot an email, you tell people what you're doing, and you connect and you stay engaged. So if you can help me welcome Katie to the podium so she can tell us whatever she wants.
Hi, good morning, everyone. I'm going to start off by just giving you a bit of background on HHS. We are the public health department for Dallas County. So we are nationally accredited. We serve the city of Dallas, 31 outlying cities, which is a population of almost 2.7 million people. So we have a budget of about 350. We have about 650 here. And so our ultimate goal is to protect and optimize the health of all Dallas County residents. And so we see ourselves not so much as a clinical provider. So we're not the major provider of services in Dallas County. That's more where you get your Parklands, your Baylor Scott, your other healthcare providers throughout. We are more of we consider ourselves a chief strategist. So it's about bringing partners together and making sure that we plan a strategic plan for how we're going to improve healthcare in Dallas County. And so we have an array of services. We do have some clinical services, mostly for uninsured or underinsured individuals. So we do usually things like STI, TB, immunization. And then we do infectious disease and chronic disease surveillance, prevention, and response. We do emergency preparedness, which is where you get things like COVID and Mpox response, so Mpox. And then we do things that people usually don't think of the health department doing. We have an environmental health team. We do your restaurant inspections, things like that. So I was asked to provide a bit of an overview of the state of public health, in Dallas County. And so you really can't talk about public health for the last 3 years without talking about COVID. And we in Dallas County, because of the DFW airport, we are usually at the center of every infectious disease response in Texas and in the nation. Because we serve as an international hub and a lot of these infectious diseases start overseas, we get the first case of pretty much everything in Texas. So lucky us. In Dallas County, we had over 721,000 cases of COVID over the last few years, and we had over 7,000 deaths. So COVID over the last couple of years has been the third leading cause of death in the county. More importantly, COVID has sort of highlighted some of the health disparities that we've seen in our community. So COVID highlighted the mortality rate for COVID higher among Hispanic and Black residents in Dallas County. And we've seen this throughout our community health needs assessments for other diseases, other chronic diseases, other infectious diseases. But it's really the notoriety of COVID and the sheer death toll of it really brought attention to these issues. And in addition to sort of being a public health emergency, it was also a public health response. So we did over 4.5 million vaccines, doses of vaccines here in Dallas County. So that's your first, second booster dose. And so what we did to sort of address some of these disparities that we've seen is we got, every time you get a vaccine, your information goes into the state database, the state immunizations registry. We would pull down that data, do a hotspot map, and we could identify down to the neighborhood level, the census block level, who has the lowest vaccine rate, and then we would target activities for them. So we would do pop-up clinics. We would work with churches and faith-based organizations, we'd work with schools, we'd work with businesses. We had clinics and barbershops. Anyone who was willing to have us out, we would be there. And so it was really COVID was really an opportunity to rethink how we do public health response in new ways and really serve the community and bring our services to the community rather than the community coming to us. Now, I said COVID was the third leading cause of death. The first two remained heart disease and cancer. And so over the next few years, what we're doing is transitioning out of COVID response and into more traditional public health activities. So that is going back to chronic disease prevention and really making sure that the community is aware of these diseases, and they are, because we've done focus groups, and the number one topic of concern in Dallas County is chronic disease, specifically diabetes. So that's what we're seeing, what the community wants us to really go out to and to address over the next few years. And again, like I said, these chronic diseases also highlight some of the disparities we've seen. So Hispanic and African American communities have the highest death rates for chronic diseases across the county. And then one of the things that we really need to start thinking about for public health, and we have done that over the last few years, is addressing those social determinants of health. So we are looking at how your built environment affects health outcomes. So how does transportation access, how does housing insecurity, food insecurity address a person's ability to seek healthcare resources? So it's more about a focus on human experience rather than it is a focus on abstract concepts like housing insecurity or food insecurity. So how do I interact with the healthcare system, and what barriers do I as a person face in getting and seeking services? So in Texas, probably one of the biggest barriers is cost. We have the highest uninsured rate, so both number of people and percentages of uninsured individuals. So we have an uninsured rate of 21%. The state has an uninsured rate of 17%. So Dallas County far exceeds the state. And that's uninsured. That's not people who are underinsured. So there are people out there who have insurance but cannot afford their deductible or their copay. And so that's one of the largest barriers to seeking access to care. Another one that we've seen and was really exacerbated by COVID was transportation. So we have that I-30 divide, and south of Dallas, there are fewer clinics, and so there's very limited public transportation here in Dallas County. So really having to go out into the community and again bring those services to the community because they can't come to us. So it's really, again, rethinking how we do public health moving forward. We've done it for COVID, now we need to start doing it for other things. And so lastly, just thinking about the future of public health, what is in store for you all? So one of the big focuses going forward is really focusing on infrastructure. And by infrastructure, I mean data systems and workforce development. So be lucky you are public health professionals now and not public health professionals 4 years ago, because when we first started our COVID response, we were getting paper reports. So they would get a fax, someone's test results, type it into our system, and then someone have to do a double check of it. All this, it's a very slow process. We had probably 2 rooms about this size filled with boxes. That's how many COVID cases we were receiving, and that's how much paper we were receiving. So now it's all electronic. Receive a case report directly from the hospital system. We're working on getting smaller clinics updated on these systems. And we can do that all for COVID. We can do it for a couple of other diseases. And now we're moving into the other 80 reportable diseases in Texas. So things like HIV, TB, other infectious diseases that are more common. And so that's really the future of healthcare. And one of the big focuses is health IT and health data modernization for the next few years. In Dallas County, we're actually, because our director is one of the key people for data modernization, we're actually even further along in that process than the state and further along than most states in the country. We are one of the leading experts on data modernization. So if that's an interest area for you, we do have internships, just a shameless plug there. So go talk to LaShonda, who's back there. If that's a topic, you'll be working directly with me and the director. And then the final sort of topic for the future is moving toward what we call a One Health approach. So traditionally, public health has been in silos, right? So we only do clinical care. We only do XYZ disease. Doctors only specialize in certain fields. But right now, it's really the focus on the integration of human health, animal health, and environmental health. So we've done the human aspect. We have all seen how these infectious diseases typically start in animals. They can be transmitted between human and animals. And so we really need to do more outreach with our vets in the community. We saw it here in Dallas County, COVID in tigers at the zoo, COVID in gorillas at the zoo. It was human to human or human to animal transmission and then animal to animal transmission. We have to be prepared for what the next emerging disease is. So that's something we're looking at. And then environmental health. A lot of people see climate change as just an environmental policy, but it's a public health policy. We have seen every year we get cases of death related to extreme heat. We have seen how extreme heat affects underlying chronic disease conditions like kidney disease or heart disease. And so those sorts of issues, we see how air quality affects asthma. So we need to start addressing climate change, not as an environmental issue, but as a public health issue. And so advice for future public health professionals, think about public health holistically. Don't think about it in silos. Think about the underlying human experience for individuals. Don't think about abstract concepts. Center all of your public health activities on equity. So look at those social determinants of health and look at that human experience. And how can we reduce those barriers so someone can have access to the healthcare system? And then think collaboratively and really focus on those non-traditional partners. So prior to doing COVID response, we didn't really work with our faith-based community as much as we should have. We need to engage those non-traditional partners and bring them into the fold because they are the ones who know what the community needs, and they are the ones who can tell us how to best work with the community to provide those resources. That's it.
Thank you, Katie. I think from a student perspective, you pretty much touched on everything that our public health program addresses within our curriculum. Thank you very much. And COVID broke the normalcy, I think, of everything that people thought public health was about. And it allowed us to think outside the proverbial box, how we can get things done. And your point on health informatics and public health utilization of technology is on the forefront. And thank you for your comments. All right, with that, I'd like to call up our panelists so we can get into this and share some vital information for the students here and those viewing via Zoom. Oh, no. I'm gonna let you introduce yourself. Dun, dun, dun.
Yes. I'm right.
There, where you? Great.
I'm LaShonda, but not the LaShonda they said to see about an internship. Good morning, I'm LaShonda Mallory Moore, and I'm the director of the Waco McLean County Public Health District. Dr. Creel, do you want us to do the whole introduction right now? On your.
Yeah, let's just go down the line, name, where you work, public health, what public health looks like for you on a regular basis, and briefly share your career path and how you ended up in the current role.
Okay, so like I said, I'm LaShonda. I'm the director of the health district in Waco, McLean County. I've been at the health district in Waco for about 2 years now. And prior to that, I was the communicable disease program manager for DSHS Public Health Regions 4 and 5 North, which is basically all the area that's Northeast Texas, all the way up to the Oklahoma border, over to the Louisiana border, and as far south is the Deweyville area, which is in the middle of nowhere. So I don't know if you're familiar with Northeast Texas, but that's a very interesting part of the state. Over the last 20 years, and I had a panic attack earlier in our advisory board meeting because I realized in August I have been an undergraduate graduate for 20 years. I'm the old lady. I've been out of college a long time. So it hit me just this morning, but I've had a really great career in public health. I've done all kinds of work. I've worked in a poultry processing plant doing corporate wellness work. I worked for a for-profit healthcare organization at a home health agency doing marketing. I also had opportunity to do community-based participatory research at the UT Health Science Center in Tyler for a little while. So my career has been so varied, and a lot of people say you had a lot of jobs, but you know, in public health, you kind of follow the funding. And up until recently, the funding was very sketchy. You never knew what was going to happen. So I've been in roles where we had a 5-year contract, and then they decided not to extend it, and you got another year, and you just hoping and praying that they'll keep you. So it can be a little choppy sometimes, but what it has also done for me is taught me to diversify myself. I feel like I know how to do a lot of things, and because of that, I've been able to market myself pretty effectively. So I've had a great career, like I said. I went to college as a nursing major, and I had tuberculosis one summer, and during that time, I had a wonderful DOT nurse that took me to a nurse education program called the Nurses of Oz, and it was about nursing epidemiology. And I quickly learned that I liked disease surveillance much better than I did being a clinical care person. And during that time, my mom had her first of 5 heart attacks as well, and she lived a life that was laden by tobacco use and not taking very good care of herself. So I've committed myself over the last 20 years to make the healthy choice, the easy choice for communities that I work in. And you do that by creating equitable policy, by exercising as an example, meaning I practice what I preach. I'm a walking advocate. I dedicate hours of service every month to an organization called Girl Trek. It's a national nonprofit committed to getting Black women to walk every day for self-care. And so I just feel like I try to practice what I preach and walk the walk and talk the talk.
But before you give that mic,
What does every day look like for me?
no, on that, and how does your job role intersect with other areas of society such as politics, economics, and social justice?
So because I'm not very diplomatic, my interaction with politics, economics, and social justice is typically really choppy, and it includes city management looking at me like, don't say anything. So our health district is a city-county collaborative. We have funding from the city of Waco, which owns the health district. And then we have 17 partner cities that give us a per capita rate based on the number of people that live in their city. And then the McLennan County gives us a per person rate for everybody that lives in the county. So I have a great opportunity to interact with politicians on a regular basis, including commissioners and city council members that are on my board. I work pretty closely with our city manager's office that works directly for our mayor and council. During the COVID pandemic, like, I can't remember her name, that was just over time. Our Dallas County partner. Like Katie said, you know, that was kind of public health forced into the spotlight, and before we just did a lot of background work. But to layer all that in with the economy, and I said this earlier in our advisory board meeting, if you don't have a well community, you don't have a well economy. Sick people and unhealthy people can't go to work. And if people can't go to work, economies can't thrive. And I don't know if any of you have been to Waco lately, but it's growing. And Chip and Joanna decided to make it their Disneyland. And it's a little bit annoying, but our service industry is growing. But unfortunately, people that work in the service industry don't make that much money, and they're usually unemployed. And so we have to do a really intentional job of making sure we offer really good public health wraparound services. And we do that in relationship with our FQHC, Waco Family Medicine, to make sure that happens for those people. So it all works together, and social justice is just that underlying part. We all know that systemic and institutional racism is real. Whether we want to call it spade a spade, it's real. And then sexism is real. So women historically have not been treated kindly in the medical field, and Black and brown people definitely haven't been treated kindly. And because of that, it's my intention to make sure everyone in McLennan County gets treated equitably, no matter your color or your race, and even your geography impacts that. We have a lot of rural community members that are pretty much mostly white, and some of them are also very, very poor and despair, but don't even recognize that because of their skin tone. So it's important for me to do a good job of educating my staff on how do we talk about disparities that just aren't race disparities? How do we talk about social justice issues that also include sexism and all the phobias that come with that? How do we take care of our LGBTQ population in a very conservative community, because we have the largest Baptist, university in the world, I think, sitting right in our, in the corner. So how do we do all of that in a way that makes everybody feel seen and heard and taken care of? So it's a pretty big lift, but it's a fun job. I'm hiring.
I'm not hiring. Not yet. Not yet. You hire me. Okay. My name is Kimra Heavy. I'm one of your professors. How do I go after you? You never was something, or you never were something. I still am a public health practitioner. My area of specialization is chronic disease prevention and mental health promotion. I know little and less about infectious diseases. Like, I don't even know the difference between the cold and the flu virus. So I think infectious disease practitioners are Marines. I'm just a happy health and wellness person. I want to touch on the intersection of politics first and foremost, because that's how I got my role with AgriLife Extension as a health agent. I had to petition Collin County's Commissioner's Court and their judge to get my position created and approved, and it took a lot of petitioning, a lot of politicking, and I'm also not diplomatic. And I open my mouth and things come out, and my boss is there standing next to me saying, shh. So in public health, you are, whether you want to or not, you are going to brush up against some uncomfortable politics. My position got created though, which is a miracle. I don't know why they let me do that. So I served Collin County. I worked next door to you for a while. I served Collin County. I worked in a lot of low-income communities, low-income neighborhoods. Again, chronic disease prevention and mental health promotion was my specialization. The Trinity, right? Hypertension, cholesterol, diabetes, obesity. English is not my first language, by the way. So if you are bilingual or multilingual, we want you in public health. We need you in public health. I got my master's at the UNT Health Science Center, but we have a master's of public health here at A&M Commerce, and I strongly recommend it. That is my plug. It's fabulous, great education, strongly recommend it. Right now I am working on a PhD in health science at TCU, and it won't surprise you, chronic disease prevention, mental health promotion is my shtick. I'm also a Stephen minister in the United Methodist Church, and where that kind of fits into my public health practice is my homeless mission. I lead a homeless coalition. It is, we call it interfaith, but let's be real, it's just different Christian denominations, so it's hardly interfaith, but we serve the unhoused and food insecure of Collin County every single Monday and every single Thursday. And the majority of these individuals are male, Black and brown, and over the age of 45. 54% of them are employed, and they are still unhoused and still food insecure. That's a product of not only our economy, but of the factors that influence poverty. So medical debt is a big one. Unfortunately, getting arrested more than once is another one. It's that disparity, that lack of equity that funneled these individuals into where they are now. And that is where my heart is when it comes to community service and public health service. Did I hit all your questions, Shane? Shane's not even paying attention to it.
I was trying to find something that I looked at previously, and I'll find it and we'll bring it up.
Yeah.
Yes, thank you so much.
Hi, my name is Aliyah Solomon. I'm an MP with Collin County Health Department. I've been with the department for like 3 years now. To be exact, I started with the COVID. I was intern at that time, and I was the one who received the first call from the residents asking about the first case that was diagnosed in Collin County. They were screaming in the phone. Yeah, and I was not allowed to say anything other than we're still investigating, and people were so angry. I have medical degree from Egypt, and I have a master's in medical microbiology and immunology. So I'm more with the infectious diseases. I
was talking about.
I used to teach in Texas A&M in Corpus Christi. And I used to teach also overseas in Egypt. And then I had my master's, the MPH, from University of Nebraska Medical Center. It was online, which was an excellent option. I had my twins, they were like 6 months when I started. So yeah, online option was great. Yeah. And then I started my intern during the start of COVID, and then I got my position as an epi with Collin County.
Political endeavors.
Yeah, so as I said, I was the one who received the first call from the community, and public health officials are all seen as the villains, as the bad guys. Whenever we are trying to promote for no gathering during the COVID, again, you can't speak about public health without speaking about the COVID. We are trying to promote for no mask, no gathering, 6 feet apart, and people receive this as kind of restrictive, and it's an attack on their freedom. And it was politicalized in an unreasonable way. The same happened when vaccines were introduced. Again, there was kind of pushing back against. So it was politicalized in an insane way. So misinformation, I believe, was the main reason for this. Also, yeah, this is how I perceive politics in the public health. Yeah, anything else?
Yeah, one of the new phrases that's out there that's being used in the electronic community is mis, mal, and disinformation. And during COVID, we were bombarded with all three. And for the vaccine portion of it, you had one administration. You know, you can say that they did good, they did bad, but that the vaccine was developed under one administration. In the incoming administration, they made a big deal nationally on the news that if it was developed under the current administration, then they were not going to take the vaccine. And then all of a sudden, the administration's changed, and now you have a naysayer trying to talk everybody else into getting the vaccine that they said they weren't going to take. So you can see how this, I mean, to me, COVID was a total train wreck from a management standpoint and trying to do the best we could for the health of our communities.
Shane, can you make sure you say it was so in defense of public health, it was a train wreck, but it wasn't the public health professionals that made COVID a train wreck. So one of the things that public health people have are resources that tell you what to expect, and you know, like what's happening. And Katie and I probably have played public health and preparedness for a long time, getting ready to react and respond. And when it was time to react and respond, the people that needed to move out of the way and let public health react and respond just didn't. And at the point that public health would have been allowed to just do what we know how to do, which is to stop the spread of disease, because it's been happening for years. Contact tracing, identifying people that are infected with something, isolation, that's a part of CDC epidemiology field work. Like if you look at the CDC epidemiology field guide, those are the first 3 steps. I'm not even an epidemiologist, but I mean that. And I'm not an epidemiologist because I can't do the data. And I'm so grateful for people like this. But we know that, you know, we know exactly what to do. The Red Book had a SARS-CoV virus listed in it, what to expect it to do, how to expect it to pass and be transferred. And I remember reading to our city management and to our mayor basically what it says about a SARS-CoV virus in the Red Book. And he goes, oh, well, this isn't new. And I'm like, well, you're a year into this response and somebody probably has already read you this, but for whatever reason, you thought that you knew better than these public health people that are trained with the science-based degree to do this work. And you just kind of got in the way, and politicians got in the way of the public health response for COVID. So I hope y'all recognize that this science that you're studying is valid, it's needed, it's desirable, and it helps communities thrive. And without public health, communities do not thrive. And so don't be scared off by the mess, the mismal and disinformation that went on, because there are people that worked really hard over the last 3 years to try to make sure that every one of you could be sitting right here today. And it was not fun. And there's a little bit of PTSD, and that our whole world needs some community care and aftercare post-pandemic that we're not allowing ourselves to get. But make sure that you think about, you know, what's real and what's not real. And y'all are smart, you know, pay attention. Just don't follow the trail.
It's not fake news.
So just before we move on, Kim, I found what I was looking for. In response to the work you're doing with the unhoused and people that are employed, the United Way has an acronym. It's ALICE, and which is these individuals are access limited, income constrained, employed, and yet they still have to rely on other public assistance to make it day in, day out. So that's United Way, and it's take a walk in Alice's shoes if you want to take a look at that.
I just want to touch back again about that bilingual. English is not my first language as well. And I never imagined that I'm going to use the Arabic here in the United States. So in Collin County, we have language line. We have some people speak Urdu, French, Arabic, and Chinese. So having a second language is very important in public health. Whenever we are speaking to a patient, English is not his first language. Whenever he feels that he can speak with someone in his own language, it relieves him and it lets him open to speaking. So yeah, if you have the chance to learn another language, that would be great.
All right,
So I guess we're gonna turn a leaf a little bit. I'm a new public health professional. I am 2 years out of my master's program with Dr. E. So thank you for inviting me today, Dr. E. I am the Assistant Director of Inclusion and Social Change at the UNT Health Science Center. I know you mentioned that. And so I do work with a lot of students, kind of like you guys. They're medical students, healthcare professionals in the making. And so I help develop their cultural competency as medical students, right? We know that that's important as you're going into the world. You need to know about different cultures and how to interact with people that are different from you, whether that's race difference, whether that's religion, disability, whatever it is, you need to know how to treat and work with people who are different than you. So that is the work that I do. And so what that looks like for me, it's a little bit of everything, right? So I meet with people at the hospital. We have a hospital on campus and we do different things. But I would say most of the time it looks like the program planning cycle that you all are probably very aware of, right? So the assessment, the planning, the implementation, and the evaluation, that is a big part of my job, is figuring out what programs, initiatives, and events can we do for our students to make them feel a sense of belonging at the UNT Health Science Center, and to also influence, maybe some of the things that they may or may not be getting in their curriculum with their programs. And then the other side of that is also making sure that their programs are doing equitable things to keep their students, right? So like we talk about retention rates, how are you accepting your students? You know what I mean? Like I'm looking at numbers. You have this many, Black and brown students, you have this many students. How are we making sure that these programs are equitable so that everybody that comes here, they're getting, an equitable experience here at the UNT Health Science Center. And so that is a little bit of what I do.
All right. And tell me about your politics.
Yeah.
So we're gonna talk about politics. I don't know if you guys have heard of Senate Bill 17, but that is essentially trying to get rid of people like me at universities that do the diversity, equity, and inclusion work that I do. So I work with underrepresented groups, Black, Brown, Latino, LGBTQ, faith-based, so that's Muslim, Christian, Catholic. So those are the people that I mostly work with, right, to help them get the resources that they need. And to just help them in school, right? We know that they experience, we talk about the social determinants of health and health disparities, that they're more likely to experience some of the adverse effects. And so I work very closely with the students. I let them know that my office is a safe place. And so we have different organizations that I work really closely with to help them get the resources that they need. And then, like I said, also looking into the different programs and making sure that they're having those equitable experiences. So like last week, we had a reproductive justice panel where our students, I think we had 3 or 4 students up there that were in like PA programs, medical programs, and teaching about their experiences. And then we had another panel where we did one about those who have like deaf, hearing disabilities and how they're able to go through these programs and things like that. And so my weeks look so different. I can do a panel one day, the next day I'm looking at stats from a program to make sure it's equitable. The next week I'm attending a panel, so I'm just grateful that I have an opportunity to kind of be in all of those realms. Public health is such a general, it's so big. And so public health is everything. I mean, we can turn anything into public health. And so then my pen says racism is a public health issue because that is where that is my field of things. And so I try to educate people and let them know that your identity has everything to do with your ability to be well. And so as students, I just remember my experience as a student, and Dr. E can probably attest to this. I was involved in so many different things, but that was because I needed resources. And so I just try to help students, kind of have those same experiences.
Thank you.
It's still morning. Yes, it is. Good morning. I'm Dr. Henry Ross, instructor emeritus, retired. And LaShonda, you hurt my feelings. She said 20 years. I retired after 40 years in higher ed. So it's been nice. But I was born a poor little Black kid in Birmingham, Alabama. I don't know if you guys know anything about Birmingham. But yes, this was almost, I'm a little over 66 years of age now. So during the civil rights movement, I got to march with Martin Luther King for about 3 blocks when I was a kid. My vacation Bible school teacher, as he was coming down the street, she allowed us to walk with him a little bit. When 16th Street Baptist Church was bombed, I actually lived 12 blocks from there, felt the bomb, rocked us out of bed, and all hell broke loose in Birmingham, Alabama on that day. But I lived in a community called Smithfield, and We were not poor, we were poor. We couldn't even afford the other OR. That's just how bad it was. And I actually had an elementary school teacher to tell me that she did not think that I was going to make it to age 16, simply because of the neighborhood that we lived in. But I had other plans, and I wish he was around today to see those plans that I had for myself. Well, yes, maybe, I don't know. It was pretty tough.
I don't know from what angle, but she's thinking.
Yeah. But I started out in public health before it was a term public health. Back then we called it community health. And in my community, there were some areas that people used to drop trash off, and the city never thought that, never saw fit to come through and clean that up. And you guys are too young to know about a Polaroid camera. Y'all know about it? Because they came out in 1947, but
They revived them a couple years ago.
really, well, we had no Polaroid camera, and I wrote a report at school and took some of those Polaroid pictures of those areas where the trash had been left, and I pasted it to my report. And after that report got around the city of Birmingham, lo and behold, those areas got cleaned up. So that was my first involvement in health, in community health. I did my undergraduate work at Kentucky State University. At that time, degrees were in health and physical education. And it stayed that way for a number of years. It's only been about 15 years ago that the state of Texas actually separated physical education and health. And we have moved more toward public health more so than health education. So by trade, I'm actually a health educator, teaching those of you who are interested in health how to research and then to take that information that you've learned and spread that to other individuals or to other groups. And that's important to me. Some of the courses that I've, in my 40 years at higher ed and in health and physical education, I've taught just about every course, but enjoyed teaching courses in community health, enjoyed teaching the courses in human diseases and human sexuality, as well as courses in first aid and safety. And believe it or not, first aid and safety is an important course in public health. What do you do at the scene of an accident and there is blood? Well, you have to protect yourself. Also, you've got to protect the victim. Just because the victim is injured does not mean that you cannot transmit a disease to them, and vice versa. Because the victim has body fluids coming from their body, you need to be protected from that as well. So we talk about those issues, and in health education, it's extremely important that you get the knowledge to be able to share that information with others. Public speaking, therefore, is very important. And I know some of you in your classes, you're asked to do presentations and you start sweating bullets. But get in the mirror and do your presentation and do it over and over and over again and learn those techniques. And let me tell you this, a lot of times, the way you can get over with individuals, anything that you're teaching, anything that you're sharing with someone, be enthusiastic about it. If you are enthused about it, let me tell you, they will get excited about it. Some of you have had teachers whom you probably fell asleep on. I can guarantee you, there's no student in my class that has fallen asleep on me. Because I'm not going to let you fall asleep. Because I'm enthusiastic about what it is that I teach and how I communicate with individuals. Communication is extremely important as well. Now, as far as politics go, my friend, I'm not on Twitter, but I'm on Facebook.
I think that's for senior citizens now, I'm not sure.
I'm a senior citizen. I believe in God. I believe in science. I believe that God gave man the ability to do what he or she does in the various areas. I was probably one of the first African Americans in Hunt County, where Commerce sits, to get the first vaccine. I got the second one. I got the third one. I got the fourth one. Hell, I believe in science. That's just me. For those of you, hey, whatever works for you, let it work for you. But Henry Ross believes in the science. And the only way, my friends and neighbors, that we can stop a disease is by breaking the chain of transmission. That's how you stop diseases, breaking the chain of transmission. So let's get the research, get the knowledge, and don't let anybody stop you from getting that knowledge.
All right. Well, hold on to that, Dr. Ross. We're gonna walk the mic back down that way, so
Let's walk.
we can be as judicious as possible here. What are some specific resources or tools that you would recommend for students or young professionals interested in pursuing a career in public health?
Resources, tools, your instructors. Very first, your instructors, communicate with them. Let them know that which you're interested in. And if they know that, they're better able to help you. Don't wait the year before you are to graduate. I would say at least 2 years out, at the least 2 years out. When I was a freshman in college, I knew going into the university as a freshman what I wanted to do. I even set a plan. And you know, my mom helped me to set that plan. My father passed away when I was 10. My mom worked 2 or 3 jobs to take care of 8 kids. Okay. And she had a plan for me because I had a plan for me. When I enrolled in high school as a freshman, my mom said, hey, make sure that they know that you want to go to college. So you need to be in college preparatory courses. Went to orientation, came back home. My mom asked to look at my schedule. Now, my mom graduated high school and that was it. And she looked at it, she said, baby, these don't look like college prep courses. I said, Mom, but this is what the counselor put me in. She said, oh, okay. And she said, did you tell him that you wanted to go to college? I said, yeah, but these are the courses he put me in. She called the boss and said she was going to be late for work the next day. My mom walked me to school and she got with the counselor and she said, did my son tell you that he wanted to go to college? Yes, Miss Ross, but she said, ain't no damn buts. I want him in college preparatory courses. All right, 4 years of math, 4 years of English and social studies and foreign languages and civics, college preparatory courses. When I got to college, I knew exactly what I wanted to do and what I wanted to become. And I started the very first day when I registered for classes to put me in the major that I want to be in. And I worked throughout those 4 years with my instructors, such that they knew that after I graduated that I wanted to go to graduate school. They knew that I wanted to become a professor at a university. So everything that I did was moving toward that goal. And I kept in touch with my instructors along the way. As a matter of fact, you guys may not believe this, but I was actually drafted free agent with the Atlanta Falcons. Went from there to Kansas City Chiefs. My last stop was with Chicago Bears. I played football in high school, played football in college, but my mom was most concerned about getting an education. Yeah, because, and I tell my student athletes, and I actually coached college football for 18 years, that any play in athletics could be your last play. So you better have something to fall back on. You better have something that you can do. And I always knew that I wanted to teach at the university level. So we made those plans, but along that way, along that journey, I kept in touch with my college professors. And there are two that I still keep in, that are still living, that I keep in touch with to this very day. So it's important to pull on those resources that are available to you, and I would start with your professors.
All right, thank you. Thank you, sir.
Go for it.
No, we can't just give them.
Well, I was gonna say kind of along the lines of that, mentors. Because for me, I feel like when you have mentors, that's like 30, that's how many ever years they are, years of experience that you can get in like 5 minutes, depending on the question you ask them. You know, so having mentors in different sectors and different areas that you can call on for different reasons. So it's just like having a circle of community people that you can reach out to, and that's professors. That is, you know, people, the staff that's at the school. So, you know, your staff members who are working in diversity, equity, inclusion, intercultural engagement and leadership, people like that who you can count on outside of, you know, when you become a professional and things like that.
So I'm gonna shift gear a little bit. I'm gonna recommend two tools online. They are offered by CDC for free. The first one is called CDC Wonder. I'm gonna share it with Dr. E, and she can send it to you. This tool, it's an easy to use menu drive system that can help you to see some of the CDC informations and data. The other one's called epinfo. Also, it's free and it's offered by CDC. It's designed for public health researchers mainly. It's for easy data navigation and construction. Also can use CDC for many courses and training programs. They are for free and they are very effective. I myself, till now, sometimes I just take a course. I have like 2 hours free at work. So I just log in and I have some like training course for infection control, for nursing home, nursing houses policies. So whatever you're interested in, you can find some programs through the CDC, and it's very trusted. So yeah, go for it.
And just for information, check out Train Texas. Train Texas is an absolutely good website. It has a vast amount of public health courses on there, a complete series in epi. So that's a good resource for up and coming public health professionals.
Just try to remember your password and username each time. Avoid making a new password.
Raise your hand if you know what call and respond is. So we're going to do some call and respond. Say strategic. 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 Okay. Say proactive. Proactive. Okay. So we got your instructors are your resource. We got your mentors are your resource. We've got loads of free training online accessible to you. Your number one resource, I think, is you. You. It all starts with you. You are your number one resource. So be strategic, be proactive. Don't be passive. Don't be passive. In 2018, I was a clinical researcher. I made good money. I worked there for a few years, got laid off. My identity was tied up in my career. I hit rock bottom. I hit rock bottom. But God knew, there's my politics, Dr. Ross. God knew that that's what I needed. I got myself into AA and I started LinkedIn. There's another resource for you. Decided I need to recreate my brand. People knew me as what I was. I need them to see me for what I'm going to be. I posted regularly. I know Dr. E follows my posts now. Yeah, they've improved, haven't they? They've gotten a lot better. My hashtag game has improved. Market yourself, brand yourself, display what you want people to see, not what you were, especially what you were was what I was. So be strategic, be proactive. So my LinkedIn game was working on that, was in AA, started volunteering with some group I had never heard of called AgriLife Extension. Never heard of them, didn't know about them. didn't know that they had been around for over 100 years, didn't know that they were in almost every single county in Texas, had no idea, didn't know. I had no money, I was laid off. I had no money, but I volunteered. And I know volunteering just deflates people because y'all want a paying internship, y'all want a paying job. I did too. I was cleaning churches while I was doing that. And that's how I got into Stephen ministry, was while I was cleaning churches. So there's my politics again. I was exactly where I was supposed to be. While I was volunteering, I was not a passive volunteer. I was a nosy Nancy. I was a busy bee. I was strategic. I took a little bit off of this person's plate, a little bit off of your plate, a little bit off of your plate, because I wanted to hurt when I leave. I want to make sure. And I told everybody, I'm looking for a job. Let me do your work real quick, but I'm looking for a job. Are you hiring? Are you hiring? Are you hiring? I harassed y'all's department too. They had this internship, this was years ago, obviously, the Zika internship for like $10 an hour. You better believe I interviewed for that job, looking up, showing like dressed like this. And they were like, you're kind of, they didn't say I was too old, but they wanted to. They were like, this is for students. I'm like, and I'm a student of life.
The oldest interns that we ever had.
You were the best looking. You're easily the best looking. So I was very, very strategic. I wanted to make sure that when I left, if I left my volunteer role with AgriLife Extension, that it would hurt. That's when we started the politicking with the commissioner's court and the judge. Collin County is one of the most affluent counties in Texas. There's money there. There's money there. And so when we petitioned the court to create a position to serve low income and no income communities and families and areas, y'all can go look this up. This is real talk. In the court, there are cameras because all the proceedings are public. That judge looked me in the eye and said, there are no poor people in Collin County. Yes, there are. And you shouldn't talk like that. That's not how you address your community. We kept going back, we kept going back, we kept going back. We petitioned each of the commissioners. All I needed was one person on my side, and that's exactly what happened. You get one person to come out and see your homeless commission, see your coalition, your interfaith group. That's all I needed was just one person, and that's all it took. I was very strategic. I was very proactive. I was cleaning churches and getting food from the food pantry. Worked that job for a few years, loved it, loved that job. Applied for a teaching role at A&M Commerce, went through all the phases of interview, didn't get the job. I was furious. I was livid. I wore blue and yellow to the interview. Okay, I was so cute. And I was adorable. And then they sent me like a list of follow-up questions. I created a video for the follow-up questions. Who does that? I was very proactive. They didn't hire me. I was so salty. I was like, forget them. I was so mad. So I'm working my AgriLife job, wanting to teach. Nothing was happening. There was a nutrition position posted. I'm like, I'm a nutritionist. Why can't I teach? Called A&M Commerce, still salty, still mad at them, still mad. And they were like, well, this role falls under some guy, I don't know, some Dean Culpepper guy. Don't know who that guy is. I'm like, well, I'm proactive, I'm strategic. I am my number one resource. So I called him and he was busy writing a grant. Y'all, grants are so important. Like, you don't even know how stressful grants are. Like, we're all public health practitioners. We need grant money. We need grant money. He was like busy and stressed. And listen, we're gonna have to talk about this later. Like, I'm like, this guy doesn't even know. Like, I haven't even given him my pitch yet. So I'm even saltier now. Follow up. Now I'm a pain in his side. Yeah, aren't you glad? Yeah. How persistent was I?
Yeah, he's got that look on his face like, I don't know.
Follow up.
Dr. Culpepper, I'm glad you didn't put me on that committee.
Now I'm on a committee with you, Dr. Rod. Now I'm on a committee with you. So, strategic?
Proactive.
Who's your number one resource?
We are.
You. Be strategic, be proactive, be persistent.
Because I don't have anything to say after this.
Now you know how to feel.
All right. What do you believe are the most important skills for someone pursuing a career in public health? I know you and I have talked about this before.
Strategic. Skills. Like, can you pay my bills? So you have to be able to do something. You can't just say, I have a degree. A lot of people have a degree. What can you do with the degree? So I have a lot of junior level employees at my health district. And I say junior level because I don't want to say they're young professionals. They're just junior. They're still learning. They're growing. And a lot of them come with a lot of thoughts, but being able to take those thoughts and put them on paper in a way that you learn in public health school, in a logic model, and SMART goals and objectives, you know, the things that we need to measure our progress, those skills have to be transferable. So all the things that you learn doing your coursework, you need to be able to take that and apply it to public health practice. And it actually does work. Now, does it work as seamlessly as it does in class? No, never. Because what happens is we get real people with real problems and no budget, and we got to figure it out. So you definitely need to be able to transfer your skills that you learn in class to actually being able to do public health practice. If you do not like talking in front of people, you have to learn how to talk in front of people to be a public health person, no matter what job it is. Even the epidemiologist has to be able to have a conversation with someone, because who do you think does investigation outbreaks? Epidemiologists. They call and interview people. They call and ask people, where did you eat? What did you eat? How much of it did you eat? Did you pay for it? And a lot of them, you think that's silly. That's important. Did you tip them? Because, you know, maybe somebody did something because your food, you didn't tip them. But, you know, those are the kind of things that you need to be able to do. Have some good, strong data skills, able to use Excel efficiently. A lot of public health programs are not where Dallas County is with the data modernization. Dr. Wong is like, I fanboy him at TATO meetings every other month, and he's like, get away from me. But he is all about data. I'm not a data person, and I don't have the budget to invest in data modernization like a Dallas County does. But what I do have is I have Excel, I have EpiInfo, I have access to SAS or SPSS if needed. So make sure you know how to use some of those programs, even just enough to do some basic data analysis with it. And also make sure you know how to build connections and relationship with people. My friend Crystal always says, my good friend Crystal Bryce, I'm gonna give her credit. She always says that you have to have the gift of woo, and that's winning others over. And part of having the gift of woo is being able to know who you are before you go try to woo somebody else. So everybody presents differently. There's a woman named Siobhan Arline Bradley, who was a health equity trainer for my team over the last year. Now she's the the executive director and CEO of the National Council for Negro Women. And Siobhan has this big, bold personality. She's dynamic. She pulls everybody in. And I'm like, I want to be able to talk like her. And I'm like, but that's not my style. So I know my style. My style is typically a little bit goofy. And my kids will tell you I'm a nerd and don't really know much. I got excited about the hydroponics thing when I was walking through here because I like that kind of stuff. But you know how to woo people, like how to get people on your side, but not in a way that's manipulative, but in a way that's authentic and unique and genuine and transparent. You know, just be yourself. But that's really important. And be a self-starter. If somebody gives you a task, they'll ask me, what am I supposed to do with it? Figure it out. At least try, because what supervisors and managers want you to do is take the first go at it. Even if I correct you, know that it's coming from a place of getting you to the best work product ever versus you're being punitive and you're banging me down. Because I have young staff that feel like anytime I correct them, it's punitive. And really what it is I want you to be proud of the work you do. We have some staff that presented at the Texas Association of City and County Health Official Conference. And this young woman had a poster. It was okay. I wasn't crazy about it. The data analysis was weak in my opinion. And I had a lot of questions about it because She's putting my name on that poster with her, my health district's name on that poster with her. That's tied back to my city manager, to my city council and mayor. So I need to make sure that whatever you taking out somewhere is something I will be proud of. So don't embarrass yourself and don't embarrass me. You know, so just have that pride that it takes to walk into a place and say, I'm here, I know what I'm doing, and if I mess up, I'm gonna listen to you and receive the correction in a way that's beneficial rather than you hurt my feelings, because it's never really meant to be punitive. It's really just to try to get you to your best potential.
So, let me just add to that. Everything that we learn in the classroom is for a specific purpose, and that's finishing that class. And obviously getting a good grade and moving on. But the learning doesn't stop at the end of the semester. It requires you to keep engaged, keep learning, engage in self-learning. And I know a lot of us have experience with Excel, and some love it, some hate it. But it's a product, a tool that's out there that we have to become familiar with, spend some extra time, learn a little bit about how to put that function in that cell, do something because everything that you do is going to benefit you when you get out to the job market. And the next question is.
Dr. Creel, can I make one more comment about being able to do things? I think that the teaching experience does not stop whenever you leave undergraduate or graduate school. So every day I find myself giving these little mini lectures in public health. Because a lot of times in public health departments, and those of my peers from Dallas County will tell you this, there are different levels of employees in a local health department. You have people that are PhD level researchers that, you know, make the thing happen. And then you have clerks that are just checking people in at the front desk. But you want everybody from that base level person that's checking people in to that PhD person to understand the value of public health. So in my first 2 years at Waco McLennan Public Health District, I have been teaching my staff about what my view of public health is and what our vision for public health is going to be in McLennan County. And it's been a mindset shift because the previous director, she was terminated after just a few months. So they were a little bit gun shy because you're not going to stay. What, you know, are you going to be here? And I'm like, well, I don't know where to go. I ain't got no husband, no where, I ain't got no house. There I am, and these kids. You know, and the woman before her was there for like 20 something years working at the health district in different levels. And she kind of just grew with her career grew in the health district, and she didn't have that fire and passion. I'm a public health practitioner. Like, that's what I do. It's so much of who I am that if people said, if you had to change jobs, what would you do? I don't know how to do anything else. So it was really important for me to keep teaching my staff my vision of public health. In our new employee orientation, we do Health Equity 101, Public Health 101, because we need everybody from the sanitarians to the epidemiologists to understand what our vision, how we do public health in Waco McLennan County. So be open to learning consistently and don't push back, just listen, because people are going to pour into you, but you got to stop and listen and recognize you just might not know. So I'm sorry, don't apologize.
Let's start off talking about the abilities, having those oral skills, verbal communication. I'd also like to talk about your writing skills.
Oh.
It is extremely important that we learn to write well. Professionally, indeed. And there are some tools on your computer. If you just go up to that editor button on your computer and use that will help.
If it's got a red line under it, it's not that.
President Davis, I'm in the process of, over the last couple of weeks, I've been critiquing 17 papers for publication from students. And on some of those papers for publication, I've almost had to rewrite. Okay? Work on your writing skills. Writing skills. I can remember as a freshman going to college, First day in class, and I have to tell students this too, always be prepared. I will have students come to class, first day of class meeting, no pencil, no paper, nothing to write anything down with. So I guess they're gonna get this information by osmosis. But nonetheless, freshman in college, first class, instructor comes in, he did not even introduce himself. He asked us to pull out a pencil and paper. It was an English course. And we had to write a few paragraphs on the sound a leaf makes when it hits the ground. That was my first assignment in an English class, the very first day of class. I got out of English very well. I passed that assignment and the rest was history. But learning to write well is extremely important, especially if you're in the process of having to write grants, if you are having to turn in reports. If they're not written well, it could be the difference between getting the grant or having that report accepted or rejected. I was able to increase my salary by $38,000, moving from one job to another because of my resume. And I went to a professional conference and I was looking for alternative employment from the position where I was. And they had a room where you could go in and turn in your resume for interviews and those types of things. Took my resume in, the lady that was taking the resumes looked at my resume, boy, this is very well written. And she said, I'm gonna use this as a basis. I said, what do you mean? She said, I'm gonna make sure that this one stays on top. So I hid out over in the corner to see if she was gonna keep her promise. Every time someone would bring in a resume, she would look at their resume, pick up mine, she put theirs down, put mine on top. At the end of the day, there were about 500 resumes there. Mine was on top. I was able to get a job at another place, increase my salary from one to the other by $38,000. Learn to write well.
I just wanted to say that paper, which is the community health assessment needs, the 20-page paper, Dr. E got y'all writing. I use that paper to this day. If I need to create a report for a program, I always have to prove why I need money for certain things. And so within that, I use that report, literally the wording, like sometimes I just need the wording, like the paper that I write those years ago. And importing the data and just changing those things, I use that. So keep all of those resources, tools, all the things that you're writing right now could be useful for you in the future. So Dropbox, whatever you use to keep all those things, you need to have your different versions of your resumes, your cover letters, like you need to have a place where you're keeping all of this information because most of the times you're probably not going to turn in the exact same resume cover letter to your employer. So you need to have different versions of that already ready so that, you know, I feel like job searching is like a job in itself, right? You got to write these papers, you got to have cover letter statements and things like that. Keep all of that stuff because it will.
Cover letters now, if you're applying to Texas A&M College Station, put a Texas A&M cover.
Sure you change.
I get some of those on applications.
We got one more.
Yeah, so one of the important skills I believe public health professionals should have is be patient. Don't expect that when you're calling a patient or a case and trying to educate them about something that they would be convinced immediately and do whatever you are saying. You have to be patient. You have to push softly against any misinformation. So one of the traits that I believe is important for public health professionals is to be patient. That's it.
All right, since you have the mic, let's continue on. Jobs usually ask for public health experience. And at times, students feel they do not have any. How can students gain practical experience and exposure to the public health field while still in school?
Volunteer.
Yeah. Yes,
That's it.
volunteering,
Get
yes.
involved.
Yeah, and again, be patient. When you are applying for a volunteer position, many times you'll be rejected. Don't let this put you down. Just try again and again. So when I was doing my master's, I had to do this capstone experience and the internship. I kept looking for like 4 months. and I was about to start the new semester, and my college was in Nebraska. So they are not able to help me in finding any positions. And I'm here in Texas, so they were, how can we help you? I just kept sending emails and sending, I went by myself to Collin County to ask for an internship or a volunteer job. They said they don't have right now. So after this, like a year, they called me back telling me that they have a position. So volunteer. And whatever you're doing, add it to your resume. Don't forget, add it. Even if you are doing any volunteer job at your college while studying, add it to your resume.
Cheerleader. Before COVID, there were a lot fewer things online. We can agree to that, right? Now there are internships online through Texas Health and Human Services, other state human services, CDC. There are a lot of internships that you can now do online alongside your coursework. So it is a little bit easier now. You don't necessarily have to drive however far to the site to do your volunteering, getting that experience. Because I understand y'all are busy. You've got a whole bunch of coursework. Some of y'all have jobs. Some of y'all have families. Don't hear this as criticism. Hear this as encouragement. Hustle, hustle. Make yourselves uncomfortable. Be hungry. Hustle. Don't be comfortable. If you're comfortable, are you growing? Are you learning? No. Be uncomfortable and hustle. How long did we struggle?
Oh, wow.
How long did we struggle?
I'm still struggling.
Dr. Watts over here, he's retired and just
I'm still struggling.
hustle. You can do certain internships virtually. If that's what you need, do it. But if you can do something in person, please get that experience. Why? Because then you can network with people. Then they can see your face. Then you can take work off of their desk and make their lives easier. And they think, I really don't want you to leave. Let me go write that grant to give you a job, because if you go, this is going to hurt. This is going to be really uncomfortable. And I believe you said this. No, Katie said this. Churches count.
Yeah.
I promise you, your church is doing something in the public health space and they just don't know it. Is there a food pantry? Is there homeless outreach? Is there a blood drive? Is there? And if there's not, you make it happen. Go harass your pastor. Excuse me, go speak lovingly to your pastor and you make it happen. You think blood drives just happened at my church? My pastor's favorite thing is, sure, that sounds great. You do it. Okay, so go and do it. Create a public health experience for yourself. Hustle. Be uncomfortable, grow.
Yeah, so I've learned over the years, and it was based on some good advice that I got a long time ago from a college counselor, that to be relevant, you have to take something away, such as Kim did from all of her coworkers at AgriLife, and make it yours. You ease their burden a little bit, and then your relevancy is forefront when all of a sudden there's no money. So if you can ease somebody else's burden by accepting some of their responsibility, then that makes you a asset to wherever you're at. And then I would also say that you're not going to start out with $100,000 out. Today's market, I know everybody, and I experienced this, everybody wants a six-figure salary right out of college and think they deserve it. So my daughter, she's a recent Master's in Public Health graduate, and she went to Florida, applied at a hospital to be a infectious disease, like control. Yeah. So, she didn't get the job. She called me and she goes, I didn't get the job. She goes, but there is a, administrative job that I could take. It only pays $20 an hour. And I'm thinking to myself, $20 an hour, right? So I'm gonna date myself a little bit. Dr. Ross probably, he knows, but I had my first job when minimum wage was $2 an hour. Okay. So we've come a long way from $2, right? And, but I would work 50 hours a week for $100. Right? And I know Dr. Ross knows exactly what I'm speaking about.
Yes.
So I told my daughter to apply for the job in the hospital. Right? She has a bachelor's degree in pre-med biology, a master's in public health, and she's going to apply to be the telephone answerer, person checking in and stuff. And I told her, I said, it's not about what you're doing now, right? Get in the door. And then when that other job comes open again, you move into the other position. And I had this conversation with Dr. E. She's been there 6 months and she has been promoted twice. And she now works as the business development person for the corporation and is, making 51 grand. So just get in. Don't dismiss it because it's not $100,000 a year. You get in the door, you make it happen, you show your worth, and then the people around you see that you have a work ethic and can write and move up within the organization that you want to work with. Okay?
They don't know anything about a summer cost.
Don't know nothing about that.
So the money conversation,
Sometimes it runs, sometimes it don't.
That's it.
the money conversation is real. And I know y'all are all in higher ed because you want to get a job, right? Any of y'all independently wealthy and don't need to work? If so, is your daddy married? Looking to be saved. Seriously, you don't make a lot of money in public health right now. It's just not that kind of a career path. But I'm gonna tell y'all this: what you get back from public health is a sense of fulfillment. That if you are working in your purpose and working in the place and the space where you're supposed to be, you feel so good about the work. My first job out of college, I was an abstinence-only sex educator.
That's tough.
I learned everything you shouldn't do with a public health grant, number one. And I learned a lot about my ability to put my own personal ideals and beliefs aside and do the job that I was hired to do. The woman that was the program director ran for Miss Texas, or she was campaigning to be Miss Texas on the abstinence-only platform. And somebody gave her a multi-million-dollar grant to do abstinence-only sex education in parts of Northeast Texas where it was not a real reality for some young people. So, I learned a lot. I learned a lot, and I only make $985 every 2 weeks after taxes. That's not that much money, but I did my whole life.
That's a
I had
lot
an
compared to
apartment, I had a
$2.
car, I had all that. Yeah, exactly. So over the years, I have increased my salary, but I told you I've been an undergrad for 20 years. And it's been small increases, and there have been a few large increases. And before this position as a director, I was married at the time, and together we didn't really have money issues, but we didn't have much extra money either. So all of the hard work that I've put in over the course of my career and working for people that I'm pretty sure I was smarter than, even though they had terminal degrees or they were physicians. But I'm like, I'm doing all the work and y'all taking all the credit. You got to get out of your own way sometimes and just sit with it. You put somebody's name on the beginning of the publication knowing dang well that they did absolutely nothing to earn that. But y'all just heard me say that somebody took a post and they had my name on it and I didn't do no work on it, but yeah, they weren't going to embarrass me. So, but just be patient with the financial situation. Don't live above your means. I know social media influences your generation a little bit more than it did ours, but y'all got to sit in the reality Most people that you do life with and that you play with on the weekends, play, meaning go out, have drinks, have a good time with, go to church with, or to faith-based places with, they are not living $100,000 a year life. They're living a $10 to $15 an hour life. Like, cause that's the stage of life that you all are in. And just be okay with being in that stage of life. Because whenever you do get to the stage of life where you're able to buy the fancy thing and spend $2,000 on the handbag, you don't do it because you realize that's dumb. You change your mind and you buy the replica and don't nobody even know. Don't ask me how many fake Louis I got. Nobody even knows because who all up on your stuff like that, right? It's all right. I ain't got it with me today. I have to smile and see my little sisters. But really though, y'all, just remember, just be okay in the phase of life you're in because you don't want to be the boss right out of college. You need to learn how to do the job, learn how to be good and secure in who you are. Because if I would have had this role even 5 years ago, I wouldn't have been able to be successful. So just take your time and grow as you go.
Finances, even though I'm retired, I guess that was the niche Dr. Culpepper needed me to fill, so he asked me to come back and teach. I am teaching a couple of courses in the Health and Human Performance Department. And not only that, because I've been a department head for about 5 years, a buddy of mine over in counseling asked if I would come over and be his interim assistant department head. So I'm doing that in counseling as well. But even though I'm retired, one of the things that I do now that I did when I was fully employed, each and every month, I pay myself. Guys, do that. Pay yourself. When you get your paycheck, I don't care if it's $5 or $10 or $100, pay yourself each and every month. Put some of it back, okay? I would encourage you to do that. And before you know it, and when you get to my stage at a retirement, and you got your cars paid for, you got your house paid for, I mean, I love traveling. Yeah, and I've already told my beneficiary, who's a niece of mine, she's a nurse. I said, baby, don't count on your uncle's money. I said, because he's gonna try to spend every dime he saved or worked for before he goes. But if I go, she gonna be sitting pretty. But no, pay yourself. Pay yourself.
Dr. Ross, I'm available for adoption as well. I just want to amplify what Dr. Ross has said. My very first legal job was for the city of Plano. We all worked before 15. My very first legal job was for the city of Plano, and it was part-time. This was a long time ago. Back then, certain part-time positions with the city got a little bit of retirement. I didn't know what that was, and I didn't care, and I really wish that I did. I really wish I could go back and talk to 15-year-old Kim and say, this is huge and you don't even know it. So no matter what you make, if you can, if it's appropriate for you, open yourself a nice, tidy little IRA, Roth, traditional, you need to evaluate that, which one is good for you. You could have both. Put money in it. Put money in it, put money in it, put money in it. Pay yourself first. I really wish that I had taken that more seriously when I had that opportunity at the age of 15. I didn't know. Nobody told me anything about anything. I didn't know. Pay yourself. He's right.
Yeah, so I will also say that, unless you have something that's going to get you that six-figure job right out of the gate, it's taken years to get to where we are, right? And I'm on career number 2, right? I'm like Dr. Ross, but I'm much younger than he. So I spent 22 years in the Navy, right? And thank you very much. And I retired, the first time I retired, I was 48 years old, right? And now I'm a young 56. But so I want you to know that it's taken years and it's gonna take you years unless, you have somebody that, is paying your way now. It's a struggle, and it's gonna be a struggle until you find the niche that you are destined to be. I feel like all of us are destined for something. We just don't know what it is. And I still don't know what it is. I'm still learning, right? And I think we all are still learning. And it's beneficial to keep exploring, keep finding something that, that you really want to engage in, and then give it everything you got. Learn everything you can learn about it. And then once you've mastered that, there's something else. Keep looking. Don't settle. Be a lifelong learner. And I guarantee you, if you keep pushing, you'll get there. But you won't get there right out of the gate. And, at some point, I know you've all heard this, more money, more problems, right? So the more money you have, the more problems you have, and the more taxes you have to pay. So, it's all fine and dandy, but there's consequences with the amount of money you make as well. So,
Well, and the money, and money is directly tied to responsibility. So you can work as a public health person and have a perfectly great career and never be in management. And you know what? I want to go back, because being the director means I'm responsible for 93 people's livelihoods every day. That's a big responsibility, and their families. People take it lightly sometimes when they say, oh, I'll just fire that person if they don't do the right thing. I've terminated 3 or 4 people ever in my career, and every time it has been the hardest decision to make, because that changes somebody's life. You tell somebody they're not getting a paycheck in 2 weeks, that might mean that family doesn't have anywhere to live in a matter of a month. That may mean children are not taken care of. That may mean women that are married to abusive partners are being abused even more, because now they don't even bring anything financially to the table. You don't know how what you do impacts people. So at the point you get to the director level or even a management level position, you become very responsible for other people. And it's a heavy weight, and it's a hard weight to carry. Oh, during the pandemic, a lot of directors retired. A lot of directors were fired. A lot of directors just didn't come back. And my dear friend, Shauna Arviso, who was our preparedness manager at Region 4-5 North, he drank himself to death because of the stress and the load of being responsible for us as his team and of his family, his mother, his children. His first wife died in front of him and his children with anaphylactic shock. And fast forward, those children are 16 or 14 and 13 now, and they don't have either parent because of stress. So there's a weight that comes with the responsibility of being in charge or managing people. So that's why I say ease into that. Don't run hard and fast. I thought I wanted to go hard and fast. I got into management early, and I quickly was ready to back out of it. And I did that. I was making some money. I had 3 or 4 people that I was managing, and it was hard, and I was responsible, and I had to fire somebody, and I was like, I don't like this. So you know what I did? I went and was a health educator again, because I was like, I'm not ready. I ain't grown enough for that. I wasn't that grown up yet. And it takes a long time to get to that point where you can carry that load. And even still, every day I wake up and I think, am I adult enough to do this? Like, I've tried 2 kids. If y'all go down in the lobby, my kids down there, because I'm dragging kids around the state, going around talking about public health. They went to Atlanta with me a few weeks ago. Like, this is real. So y'all make sure you're ready to do that. And it's like with parenting, when you're in charge of something, you have to be able to be in charge and be accountable. Because if my job ends, those 2 children are going to be impacted. If I end your job, your children are going to be impacted. So it's a lot of weight. So make sure you're ready for it whenever you get into it. That's what
go ahead and keep preaching. I'm all right. Okay.
I'm gonna pass the plate. My children ain't keep them.
I have one more, and then we're gonna open up the floor for questions, but from our panel, tell us the importance of interdisciplinary collaboration.
Okay, so I'm with the EP team. At our health department, we have the emergency preparedness team. We have the administration. So public health is teamwork. You cannot do the work by yourself. We cannot do our work without the IT. We cannot do our work without the function analysts. So even within the same team, our EP team, I'm not that quick in putting out data and getting the data. Maybe I'm detail oriented, so I can go through the data and get the information, but I'm not that quick. One of my colleagues, she's quick in getting the data out from the source. So we complete each other. We can work each other. We get the job done together. We have one of our team that's excellent in reaching out and doing the community reach out, but she's not that good at documentation. So she might need help with the notes taking. So we have the team, 2 person to do the job. So you cannot do your job by yourself. You have to. It's a teamwork. It's one of the most important skills that you have to have it or learn it to be a team player.
Well, I was gonna say that I feel like public health, like I said before, it could be anything, and so you're gonna be working with so many different people that do different things. But something that I feel like I really focused on early on was finding out what my thing was, what my strengths was, and what things that I needed to work on. Because once I got into a position where I had people up under me, then you have your supervisor. You need to know like where your niche is and kind of like what you were saying. But also, it's okay if you're not, as strong in something as you will want to be. Right, exactly. And so just, keep those things, write those things down and make sure that you are, just speaking into that if that's something you want to work on. Like for me, it's public speaking. And even though I feel like I'm not a nervous person, but like my body for some reason does not align with my mind. So like I'm up here and I'm like, I'm good, but my body's like sweat. Things, right? And so that's one of my things. Yeah, for sure. But be confident in the strength that you have because people see that. So like my supervisor and thing, when I'm talking about certain things, I make him passionate because I'm passionate about this, And so now he's like sending me conferences and stuff like, hey, you want to go to this conference and learn this? And so speak up about your strengths and the things that you need help with.
You asked about interdisciplinary collaborations, reaching across the aisle. In my former career, when I was a clinical researcher, I was not only a specialist, I was a hyper specialist. I was one of a few people in the whole world that could do what I did. And other universities, other science facilities, researchers would fly in so that I could train them for a week on what I did so they could learn and then go back home and do it and then fail and then just give me money to produce what I was producing and send it to them and charge them even more money. I was a hyper specialist. And I was very, very good at my job. And then what happened? Y'all remember what happened?
Yeah,
I got laid off with this very specialized skill. So you be interdisciplinary, you cross-train, you have a rather broader set of skills. I'm a jack of all trades and a master of some. You don't have to be the master of all, but be the master of some. Thank God I got laid off, truly. Thank God I got laid off because I had to retrain and reframe. Now you can throw me into any body of water and I'm swimming no problem. I'm swimming no problem. You don't want to be the person that's thrown into a body of water and you're flailing. So you cross-train some, you become interdisciplinary. So my specialization is chronic disease prevention, mental health promotion. I don't know the infectious disease stuff very well, but I know One Health pretty well. I know zoonotic diseases pretty well. It's very interesting. So I can collaborate with the infectious disease people if I have to. And I straight up tell them, y'all are Marines. I don't know what y'all are talking about, but I know a thing or two. Be honest, be upfront, be vulnerable, but please do learn areas that are perhaps adjacent to your area of interest so that you can cross collaborate, so that you can work across disciplines and increase your salary.
Okay, thank you. So basically, don't be a smarty pants with one skill. Is that what you're saying? Okay, questions? Who wants the mic?
Y'all want to take a quick stretch? Yeah, let's stand up and stretch.
All right,
Everyone stand. Come on, come on.
touch your toes.
Well, go up first. Here we go.
Touch my toes.
Touch your toes.
No bending your knees, no bending your knees.
You don't want to lock your knees because that will cause the joint to hyperextend and you can move.
Now you feel better?
All right, all right. Who wants the mic? Who wants it? Who wants it? Right over here.
Up there.
Yes, sir.
How y'all doing? My name's Mark Abercrombie. I'm a senior here at Texas A&M Commerce, major is public health.
All right.
My question is, what was y'all backup plan if y'all didn't choose public health?
I gotta answer that. If you got a backup plan, that means you're planning on failing.
No.
No, okay, all right.
Yeah, the backup plan, so. Let me tell you,
That's a very good question.
I graduated in 2003 when there were not any public health jobs. Right now, y'all coming out, if you graduate this year, there's a lot of opportunity. So be very grateful. So my backup plan was, I knew how to party. I was like, college girl. Now, I was like, I can go home, I can teach school because I took some education courses. I thought I could be a teacher. I had sisters in education. But I don't even like kids like that. I like my kids. I thought about maybe going back to school and going to nursing school, even because that was my major when I started undergrad, or going to a respiratory therapy program. But I was so deeply motivated to help people live better that I didn't even want the backup plan. So if you want to work in public health, work in public health. Don't let anybody deter you. It might look differently than you thought it would look. You might do like an AmeriCorps program or something where you just get a year training somewhere. You might go to grad school. If you can keep going, go to grad school. Move away, go to grad school. Come work in Waco. I'm hired, man. Talk to me. Look at that. So, but don't get so don't be okay with the other option. Like he said, if you gotta have a backup plan, that means you didn't think your plan was gonna work. And right now is a good time for y'all. I'm telling y'all, the job market looks way better right now than it did 20 years ago. So.
Yeah, so in conjunction with that, we talked about this earlier this morning. Public health touches every area of the employment sector. It doesn't just have to be the Department of State Health Services, Health and Human Services, a local health department. There are many areas where public health has a significant role. So I'm gonna ask this question. We talked about this. Do you know what a registered sanitarian is? Does anybody know what that is? No? Wait, wait a minute, wait. It is, but it's someone that works with environmental health, which is a significant part of public health. But what comes to mind? What come to your mind when I said sanitarian?
Clean.
Right? You were gonna be working with the garbage, right? So that's the things that I mean, I don't think that everybody understands all the different areas that public health has an impact in and where there's job opportunities in public health. The same thing applies with emergency management, right? FEMA, Texas Division of Emergency Management, their jobs there for public health people. Just don't think that you're going to be in a lab or that you're going to be in a state-funded agency that works with infectious diseases and stuff. There are many opportunities, health education programs, One of the masters in public health graduates recently, she's a health educator at Dallas College, right? So there are opportunities out there. Don't think you're limited to only working in a health district or something, right? Look for something, whatever you have your passion for, whatever you would want to do today, if you had a job today, whatever that is, there's public health related to it. Okay? Who's got the next question?
I was just gonna tell him to have a backup plan, I feel like the main reason why we go into fields like this is to serve. So I feel like if you lead with that mindset, you can find really pretty much anything. And that's teaching, going public health. I mean, there's just so many ways to serve, is that if you keep that mindset, I think that will kind of be your backup plan. Because there are so many positions that are open and people just need them.
Your backup plan might, like your plan A, your plan B, your plan C, might be where you work, not necessarily what your work is. It might be where you work. She's right. And Dr. Culpepper was telling me the same thing before we started. If you can relocate, I forgot we had a Zoom audience, I'm sorry, my bad. If you can relocate, do. You'll come back if you want. You might not want to come back though. There are some cool places that even I haven't heard of around this country, around this world, pay a little bit better. So I'm just saying, like Battelle is a great example. I'll be brief. There is a government contractor by the name of Battelle. They do a lot of public health research, NIH research. They're a government contractor. Their primary location is up in Columbus, Ohio. The cost of living is good. The weather's pretty good. The pay is really, really, really good. And you're going to be doing public health work. And now you can also work remotely. So if you really want to stay here, you can, but go check out something new. So your plan A, plan B, plan C might be where you work, not necessarily what you're doing.
Hi, my name is Alexandra Hansen. I'm a graduate student. I have 24 credit hours left. And my question is for Kim. So I've seen a lot of failure this last year. I started off at a hospital and worked my way up into a position I was not ready for. It was in clinical trials, which I don't love. I learned that very quickly. It was not for me. Terminated. Then a lot of other things happened. But how do you keep pushing forward and not getting discouraged?
Oh, I got discouraged a lot. Like, I think I added water to the ocean with how much I was crying. Why don't you ask that? That's a hard question. That is a hard.
The struggle's real.
It really is. Dang, just came at me with that. I cannot take credit for my survival. I can't. I can give you like actual names on my hand of people who saved my life. I would not be here in this chair if it wasn't for that. So if you have a church, lean on your church. If you have family, lean on your family. If you have friends, lean on. Sorry, y'all. And you can lean on us too. You know, your instructors, the counseling center. That's what we're here for. I am really grateful I got laid off. Truly. I know that sounds crazy because at the time, it was very close to being over for me. But God is so good. God is so good. All of us.
Fold to fold, whatever God may be for my unconquerable soul in the fell clutch of circumstance. I have not wept nor cried aloud under the bludgeoning of chance. My head is bloody but unbowed. Beyond this place of wrath and tears looms but the horror of the shade, and yet the menace of the years find and shall find me unafraid. It matters not how straight the gate, how charged with punishment the scroll. I am the master of my fate. I'm the captain of my soul. Indeed, it's in you. It's in you. Find something so to take off the edge. I talked about some. Well, in my retirement, I ride across country on my motorcycle. That's my mental That's my solace. That helps me to relax. Find something.
Mental is his love.
Yeah, find something outside of your job that may help you to calm down, help you to relax. Work, my friends, is work, but you need to find something that you can relax with as well. And I just pray that it's not drugs. I pray that it's not alcohol. I pray that it's not any of those things that's going to affect your health negatively. Okay? And while some people call motorcycles donor cycles, I wear my helmet. Even if I go 2 or 3 foot on my motorcycle, I've got my helmet on. I don't want to do anything to this pretty mud.
You will succeed, okay? You are not just going to, you're not just going to survive, you're gonna thrive. You will succeed, I promise you. You have no idea the mess and the mire that I was in. You will succeed.
Indeed.
Hi, my name is Spencer. Y'all aren't gonna like this question at all.
All right, just throw it out there, man.
Is it okay to have public health as my backup?
Yeah.
Can you come back to it after kind of what you want to do? Because this is like my backup plan.
That's plan A.
Plan A, I want to be a
Firefighting is public health.
You're gonna end up being the EMT, the paramedic. You go, you public health.
Okay, we're not even gonna talk to him anymore, man.
I'll just get out of here. I'll see y'all later. I'm taking the mic with me.
So Spencer, I'll tell you this, for our COVID response, the 2 men that carried our vaccine effort were 2 firefighters from Killeen. They lived in Waco, they knew everybody in Waco, but they worked like a 2 or 3 days on and then a whole lot of days off. And Pablo and Chris were our vaccine task force leaders. So firefighters are an integral part of public health. And I love the fire service. I think that is the coolest job ever. So if you were going to say like you want to be a professional football player or something, I'd be like, yeah.
Public health.
Yeah. But yeah, you good.
Great job, Spence. My name is Kelvin Scott. I'm a public health major, senior, so Texas A&M Commerce. I was just curious, so Miss Kim, yes, Miss Kim, okay, just making sure.
You can call me Queen or Majesty.
I was just curious, I remember earlier you mentioned that if you can go back, you would give yourself advice from a younger age saying, hey, maybe you should have done this instead of this.
Yeah.
So with all of you guys having an amazing amount of experience in the field, I'm just curious for us, respectfully younger generation going into the field, like, is there anything that maybe you guys could pass on to us and an advice kind of standpoint on going forward? Was something you wish maybe you knew back then? Yes.
All of us got to answer.
Or just anybody jump on
So
that.
I'd say, like I told you guys earlier, don't take a job that you're not quite ready for. You know, like give yourself a chance to grow and also be open to correction and recognize that it's coming from a place of you getting to excellence versus somebody being punitive to you. So just be open.
She ready. Yeah. I would say for me, the mental health thing was a big piece because I think in this day and time, we're so used to getting everything so quickly. Like, I want this job, I'm gonna get this job, I got this money, I got this. So just having something to ground yourself in, having a community to be grounded in, to take you back to a place to where you're okay mentally. That is the biggest thing that I would tell myself because honestly, I took advantage of almost all the resources Commerce had to offer. Like I was going with Dr. Hendricks, I joined this organization, I joined this, so I wouldn't say that I was think of anything that as far as that I would, speak to, but just my mental health at that time, I was just always so stressed about how things are gonna work out. And then I'm here and I'm like, girl, you could have been, just, at least having some time for yourself. back then, you know, if I'd have known I'd be here now. So I would just say, give yourself some grace. Give others grace, give yourself some grace. Not hustle, right? But I think there's balance, right? So there's gonna be a time where you need to hustle, but also some time where you need to give yourself some grace, and just take some time for yourself. So that's what I would say.
Well, that's one of the big things is just being in the moment, right? And what LaShonda said, be able to accept criticism, right? Because even Dr. E gives criticism when she puts that grade on your paper, right? That's criticism, right? When you get in a job market and you're out there and you're the employee, be able to accept that criticism. The same as you do now when you get that grade on your paper. I mean, I know everybody's expected to get 100 all the time, but sometimes you get a lesser grade, right? Be able to accept that criticism, learn from the feedback, and then, as LaShonda said, produce your best work, right? That's the goal of our program. That's the goal that we want you to take out into the workforce. Yes, ma'am.
Yes, so my advice is just keep learning. Try to learn new skills all the time. And one of the things that I highly recommend, the management skills, even if you are not in the management position. So I'm not in a management position, but when I have a new intern and I'm supervising this intern, I gain management skills and I can add it to my resume. So all the time, try to learn something new. Don't feel that, okay, I'm old enough, I know everything. No, keep learning.
When you guys are seeking or you're applying for jobs, the organization or company that you're going to apply with, do research on that company or that organization prior to, just in case you're called in for an interview. You know a lot of information about the company that you're trying to work for. So do a little bit of research before you go in for those interviews. And I know we were talking earlier, students sometimes will come to me and say, well, I want a job making good money. My question to them is, what is good money? Okay. Yeah, what to you is good money? Well, I want to make $60,000, $70,000. Hell, me too. But along with that, one of the things I encourage students to do, I say, okay, you get a job making $60,000, $70,000. I said, you need to look and see what the benefits are with that company. Because you can get a job making $67,000 and the benefits for that company, so I say you get sick, you need to have surgery, you have to go to the hospital. At the end of the year, that $60,000, $70,000 a year job may be $40,000 or $50,000. Whereas if there's a job that is not paying as much, but they have tremendous benefits, I go with that. Yeah. Why? Because when you get sick, you might end up getting a raise. Yeah. My friends and neighbors, I never lost any money out of my pocket. I am a cancer survivor. Guys, I had prostate cancer. And when I was diagnosed, I mean, I'm in Texas all by myself. All my brothers and sisters, all my family is in Alabama. I went home and I cried. I did. But after I cried for about a day, I got with my doctor and we made a plan. And I decided that I was going to, we're talking public health. We're talking health now, personal health. We made a plan. I decided to do what was called radioactive seeds implant. All right, rather than having the prostate removed, did radioactive seeds implant. Went through a plan with my doctor. It's been 4 years now, cancer-free, everything works fine. Yeah. But with having that surgery, with having to pay for that surgery, the most that I paid out of my pocket was $150. Simply because of the benefits of the insurance I had. And not only that, I had taken out a cancer policy. I got $15,000 back from my cancer policy. So, hey, my friends and neighbors, you need to, again, pay yourself. So look at those benefits.
So just before your question real quick, that's a problem that we're running into with potential employees is we try to convince them that the benefit package outweighs that $60,000 or $70,000 thing, right? But it's hard to overcome when they got a dollar figure in their mind. And I'm not gonna go to work with you if I don't get X amount, right? Because all of us in here, we're young, we're healthy, and nothing is going to happen to me, right? But tomorrow, that may change and you require hospitalization, something like that. And if you don't have the insurance to go with that $60,000 or $70,000 job, you're gonna have a pay increase or decrease. Yes, ma'am.
Okay, hi, my name is McKenna. I am a senior from Texas A&M University of Commerce. My major is public health, of course. My question was for you guys. As a woman, how do you think that, or do you think that it is harder to land a higher position or position in general? And how do you market yourself? Yes, to your first question, yes. And I would say I had a plethora of experiences, but yes, I think as a woman first and as a Black woman second. But I think there's, a couple ways that you can attack that. But I think for me, I was just, my mentors kind of coached me to be, just have my voice heard and to not want, be in a space where people are discriminating against me because of that. So if I do encounter that, then I do, and, I may express myself. But most of the time, for me, I feel like I put myself in spaces to where I can vocalize my concerns about that, right? And that's not always the reality for a lot of people. I work in D&I, so most of the time, the people that I'm going to be working with are also in diversity and inclusion. And so we have that talk. We're very frank about what does it look like as far as discrimination and things like that. But like I said, in other spaces, maybe in the healthcare, in the medical spaces, that's maybe not the case. And so I take that as a personal responsibility of mine to be able to go into those different spaces and speak to the supervisors, like I said, the medical students that are in those spaces and say, hey, this is what's going on. This is discrimination that we see. And so these are some tips so that you can hopefully not discriminate against people that you're coming in contact with. So that's just my.
McKenna, you didn't have to apologize.
McKenna,
Now,
I'm sorry for
look around. Look around.
Yeah.
The greater majority of individuals in this room are female. There are many, many aspects within the public health realm where you're going to find mostly women. Yeah. And so these are your resources. The other individuals in this room are your resources. So use those resources.
So I'll agree with Dr. Ross that the public health workforce is majority woman or born woman. And that is a good thing because women are traditionally by nature nurturers.
Yeah.
They want to take care and make things right for people. That's just the nature of being a woman. It's just what we do.
Yes, I wanted to say that, but
He won't say he.
I'm glad.
I'm glad you didn't say it. I say it.
Amen.
But I will say the majority of leaders in public health are not women. Because in some cities and counties, they require a physician to be the main person. Like the local health authority in Texas is typically a physician, but in a lot of counties and cities, the local health authority is also the public health director. So and even in state leadership at the state public health level, there are very few women in leadership. However, our new commissioner of health is Dr. Jennifer Schufer, who is a dynamic woman, who is an epidemiologist, and she's a physician, and Jennifer is the real deal, and it will be great for public health in Texas. But I show up like very Black and very woman in every space that I go in, and I don't apologize for being very Black and very woman. I grew up in a community of white people, basically. I grew up in East Texas and there were 8 Black kids in my graduating high school class. and there were 113 of us. So I've always been a very Black child in a very white space. And because of that, I think I bring a different viewpoint because my best friends growing up were white kids. And then I went off to college, and at TWU, white girls didn't want to be my friend because they had never been friends with Black girls. So that's when I started having experiences with Black women. And I realized I absolutely love Black women. I already knew that because I have 3 older sisters and my mom's Black. I got all these aunties, these people I went to church with. But I realized when I say that, I love how Black women present so differently in every space. And it's not about your hair. It's not about whether you're natural or relaxed, you wigs or weave or bald fade. It's not about how big your earrings are. I always wear earrings. I wear earrings to the gym. I always wear red lipstick. I'm a whole mess, and my hair be crazy, but my lipstick on. But it's about making sure that wherever you show up, especially for women, and this is for all women, be completely woman, however that womanness is for you. And don't let anybody make you feel bad about being a woman. And as y'all move into the next phase of life, if you decide to become a parent, that's a whole nother thing to navigate because women were looked at as liabilities up until like 1978, as far as being pregnant. Up until 1978, if you got pregnant, you could get fired just for being pregnant, for doing what women do, which is give life, right? So show up woman, show up Black. I don't play respectability games very well because I think that it's dangerous. I call a spade. I get scowled at a lot by my management because they're like, you need to learn how to act. Well, I'm not going to learn how to act because I'm here to make sure every woman that looks like me has a voice. I'm here to make sure every invisible person in McLennan County, and those are the people that don't make Magnolia look pretty, and those are the people that don't go to school at Baylor. I mean, I'm talking about the people that live on the side of the river where they're gonna gentrify in a matter of moments. Like, I'm here to stand for those people. So just be who you are and be authentic in who you are. And I see you got a Zeta bracelet on. I'm a Delta, but I'll let you make it. But make sure, lean into that because there's some foundational things that you've learned in your sorority experience that can guide you. And I tell people all the time in Delta, it's about barring bitterness from my heart and using my ability to make life better for other people. So live those virtues that you've learned in your sorority, live what you learned growing up, and just be who you are and make sure you know what you're talking about. Because if you know what you're talking about, people can't, they don't matter how you look.
That's right.
Hello, my name is Brianna Humphrey. I am in a Divine Nine sorority as well. I'm an AKA. Hello, soror. So I am a senior here at the university. My major is public health, and I have intentions on returning to school to get my bachelor's of science in nursing. And my question is, in your respective positions and personal experiences, have you ever coordinated with a public health nurse? And if so, what was their role and functions in your coordination?
They did everything.
Yeah.
They were the
I'm actually working on something right now with some nurses in the community. We have a rural health initiative, and we have like an apartment complex that we dedicate to some of our refugees and things like that. And so one of my organizations now, hold me, and when you're an organization, you got all these different letters that you call it. It's like American Muslim Women or type of organization. And so we work with them to get resources and food from different cultural places, right? Because when we give people things that are less fortunate, we just give them whatever, right? We say, well, you don't have these things, so let me just give you a toothbrush from anywhere. But we're working to give them some cultural things so that they can remember, from where they're from. And so we are like going to different stores around the DFW, like some halal, like import type of stores and things like that to give them some cultural things. And so the nurses have come in, to do health screenings and things like that. And so my students, they are coming in with the different resources. And so I think next weekend we're getting together at the apartment complex to have kind of like a Black Friday type of thing where we're giving them resources. The nurses are doing the screenings, and then the students get to, have that experience as well.
All right, we got 3 more questions. That's it, because we can keep going all day, right?
The networking can be where you ask for questions.
Right. You can pull us to the side, talk to us, do whatever you want to do, right? But we need to move on. We got one here.
I'm Emmanuel Adelbon from, I already graduated, I'm getting a second degree. So I've heard y'all talk about how y'all, Miss Kim said people come to see y'all. Because in school, we do a lot of like busy work, I would say. So what is a daily, what's a daily day for y'all? Like what do y'all do in the day? Like I understand y'all. Yeah, like what does it look like? Because I know y'all don't just type papers and do stuff like that all day.
Actually,
Not all day, not all day. I hope.
that's a good question. So I'll just tell you about my local health department. So I run a comprehensive local health district that includes a WIC program, which is everybody knows about WIC and the babies. We have environmental health. We have STI, HIV services that include a clinic and case management and disease intervention, where we go out and find people who have been newly infected with syphilis and HIV. We have epidemiologists, we have health educators, we have a public health emergency preparedness team, we have a vital statistics office that gives birth and death certificates. And then we have our admin team that I do. So on my day-to-day basis, because of the role I'm in now, I do a lot of management type work. So I spend a lot of time visiting with the division managers from those areas that I just mentioned, talking to them about the status of grants, reports. Right now, we're in the legislative session in the state of Texas. So I communicate with our Texas Association of City and County Health Officials, lobbyists often, because we're doing a lot of asks to kill a few very bad bills right now. So we're spending a lot of time doing advocacy work. I look at policy, I look at hiring practices, and I even had to justify my budget up to $80,000 just yesterday, which is absolutely maddening because we had a $60,000 drone show last Friday night. So, you think about, the benefits. So public health can be desk-based, it can be outreach-based. It really depends on the job. Of my 94 employees, I'm gonna say about 60 of those are in the building most of the time, but they're waiting on people, they're giving vaccines. We have nurses that give vaccines for children and adults. We have a TB nurse that follows people with latent tuberculosis or active tuberculosis. And then we have people that are out in the community. We have an STI intervention team that's targetedly testing in high areas of new infections of HIV or syphilis. So we can use the data that our epidemiologists can compile and do the mapping and say, this apartment complex is where we've seen 10 syphilis infections from over the last month. Doesn't sound like a lot, but 10 syphilis infections quickly turns into a whole lot of syphilis infections. So, we use the data a lot. So it's different in every job, but I'll tell you this, it is always something exciting and fun. And because of where my health department is, we get a lot of random stuff off the street. So sometimes it's just like, come sit and watch and see what you can see.
I can give you more insight about the epidemiologist. So our job is mainly about reviewing of medical records, lab reports, and then lots of communication with the IP at the hospital, with the provider to get more information about this case, and then calling the patient himself or herself, try to interview the patient, see where he or she may have been exposed, teach them about infection control, how to prevent this from happening again in the future, how to avoid the risk of spreading his or her infection to the others. So lots of communications, lots of reviewing, and then I have to keep myself updated about any guidelines or recommendation. So I have to be ready to answer any question from the community when they just call and ask about what about the COVID isolation guidelines. So it has been updated like 2 days ago. I have to be aware of these updates. So yeah, you have to be updated and your mind has to be alert all the time.
All right.
Hello, my name is Destiny Juniors. I am a senior here at A&M Commerce and my major in public health, of course. But I do plan on furthering my education into going to nursing school, like as soon as I graduate. But like in the meantime, I still want to find a job in public health. So are public health jobs like contracts or?
No.
Okay. Different? Okay. I don't want to just waste my time in the meantime while applying for nursing school, you know? So I do want to kind of find a job before I apply to nursing school. Yeah, so that was my question.
You can get, so there's a lot of, or there was a lot of remote jobs available for public health. But it's not necessarily a contract. I will tell you this, once you get a really good public health job, you might not want to go to nursing school anymore. Because you might realize that you really like the work that you're doing. So definitely look for a job and think about even what kind of nursing you want to do. And maybe you can find a job that aligns with that, or even maybe ask about a part-time position. And then that way, once you do become a student, you might can keep doing the work.
Yeah, nursing has changed a great deal over the years. There are many nurses now that have the knowledge now that doctors had a few years ago. And there are a lot of nurses now, your primary contact when you go in as a patient to see a doctor.
Wow, everybody just turned. Hi, everyone. My name's Laura. I wanted to start off by thanking y'all for all the advice. It's been great. However, I do have one question for everyone. What do you recommend international/undocumented students do when looking for a job? I know y'all recommended somebody who's like multilingual, bilingual, but most of the time, those are students or like people who come with different backgrounds. So how do they go about finding those resources and making those connections?
When you say undocumented, do you mean young people that have lived in the US, so dreamers?
Like
Yeah.
DACA,
Like DACA?
Yes, but also people who don't qualify for DACA.
so they're undocumented, they don't have a visa, they went to school. Okay.
That's tough, unfortunately. But I believe some of our NGOs and non-governmental organizations and community-based organizations may be able to offer employment that way. We have an epidemiologist that we sponsor on a visa, and it's a very expensive process, and it's something that it takes a lot of convincing to convince a company to do it. So I'd say maybe look at larger companies and in those non-traditional public health roles, meaning like tech companies that have more funds available for sponsorship. Because my sister that works for Salesforce informed me that I could be making so much more money being a wellness person for a tech company. And I was like, well, okay, well, hire me then.
Right.
And they do have funds where they can sponsor people. So I definitely think it's unfortunately a hard reality that a lot of young people are going to find themselves in. And I'll assist however I can with connections.
All right, hold on, no, we gotta stop this, hang on, question.
Hello, everyone. My name is Ali Cleaves II. So, let's say to get straight to the point. So, with the new approval of the bill that's banning like the diversity and inclusion work, like public universities, what do you think that us as public health students can do to like advocate for the like proper information to get out to people? If that makes sense, or like what we can do to like getting the information to make sure that they know that this is a detriment to not only like other people as far as learning about like diversity and inclusion, but like the public health aspect that's like the health disparities related with those, if that makes sense.
I would so I would say, like Dr. Ross said, call your congressman. That is going to be probably and not only having your voice, but getting your peers together, because numbers really do matter when it comes to situations like this. Voting matters, all those things that we always press and always say, those things really do matter, but they don't matter if we don't have numbers. So we don't have, groups of students saying, no, we need these offices, we need these personnel at our institutions. Without that, I'm not honestly sure what else we can do. So that's what I would say.
All right, one more, and we're gonna wrap up, okay? We got other stuff to do.
Hi, I'm Lauren Banning. I'm public health major, senior, Texas A&M Commerce. I wanted to ask you guys, was there a time, I feel like there was a time, it's the experience, but if you guys could share If there was a time where you were put in a situation that called you to adapt, or where you had to shift your way of thinking or find a solution, and how you were able to do so.
Let me just,
That's that.
so, everybody says, we've talked about work and what do you do and what does your public health work look like, right? So I never know what I'm doing until I get to work, right? Because there's always something that comes up that just wrecks my schedule that I had planned, so I don't even plan anymore, right? I know I have to do certain things at certain times and I try to meet those deadlines, but on a daily basis, you have to be able to change your thought process and adapt to whatever the situation may be at that given moment. So it's going to work and having a plan and then having that plan destroyed within the first 30 minutes because there was a phone call that someone had been diagnosed with an infectious disease, right? A reportable. So you gotta go through the process for that. That wasn't on my plan. So you have to be able to shift whatever your priorities are to meet the priority of the moment. And those priorities of the moments could come one at a time, they could come five at a time. And you need to be able to just prioritize them as they come and address them as they present themselves. You can't be rigid. How many people watch SWAT with, what's his name? Yeah. Shamar, right? His favorite line is to stay liquid. Right? That's what we need to do. We need to stay liquid. But I say sometimes liquid's too rigid. Right? Because we get bombarded with different requirements all the time that require us to change our thought process. And then we have to go convince others that this is a priority, that was a priority, we now have to shift that priority. Does that answer your question? I know it's difficult, but I'm sorry.
So when I start working, so we have to call the patient. So whenever I start my phone call, hey, this is Dr. Suleiman with Collin County Health Department, he hangs up on me. And you have to call them 3 times. So the second time he hangs up on me. So each time I'm saying Collin County Health Department, he feel that this is something governmental, so I don't have to answer this. So the third time I said, hey, sir, before hanging up on me, I'm not gonna collect information about you. I'm not gonna report you. I just want some simple questions to see where you may have been exposed and try to educate you. He calmed down and he completed the interview with me. So if I go with the third call saying Collin County Health Department, he will hang up on me. So you have to be flexible. Something else, again, in the beginning of my career, I don't remember why, but the patient I'm calling started screaming at me. And I'm gonna call your supervisor, I'm gonna report you. I don't remember why. I'm so anxious. And I was about to respond to her in the same angry way. Right now, whenever I have this kind of conversation with a patient, I'm so calm down. I get all the heat, and then now I'm just trying to help. It's I know that's nothing wrong you did. I just try to educate you. So if you go with your same approach every time, you will lose.
All right, thank you for the great questions. And I know there's many more. However, we have to invite Dr. E up. So she can tell us how good or not good we are.
Oh, fabulous. Give yourselves a hand. Give yourself a hand. Yeah, so we do have, we can keep going, right? This is great. Can we first appreciate our moderator, Dr. Kim Field? He's an MD student graduated in just a week and so. And can we appreciate our panelists as well? Thank you, thank you, thank you. I mean, yes. So these make up our Public Health Advisory Board, our faculty, but also colleagues. I actually did not know one of the panelists until I think we conversed on email, and hopefully one thing you can take away from this is your network is your net worth, but you have to use it well, okay? If I would have sent an email like some of y'all do, there's no hello, it's misspelled, and it's all one case, she would not have taken me seriously. Right? Remember, you are strangers to the people you're trying to connect with, and how you present yourself, even if it is on an email, matters. Okay? So we're going to do a few things. We're going to transition to that side because we also have some awesome public health professionals that are in the crowd, and I would love to see their show of hands so we can recognize you. 1, 2, can we appreciate them? 3, 4, 5. What we're gonna do, we don't have the fancy cocktail tables, right? So that way, this is a networking mixer where we don't sit, we stand and talk, right? And then read the room. If there are 5 people behind you, say, hey, can we continue this conversation on email? You see what I did there? I gave you a hint. Can I get your email so we can continue, right? This conversation, because there will be people you can talk forever with, and that is fabulous. So they're going to be manning some of the stations, and right down there is Lydia, if she can wave. This is our graduate recruitment person. She's graduate admissions, anything you want to know about graduate school at A&M Commerce, and you can see the public health sign is right there, because I mean, come on, right? So if you have any questions about grad school, not just public health, because public health is everything, right? Social work, whatever it is, go talk to her. She has some really cool goodies over there, and definitely ask her about the public health program. I mean, come on, she's a graduate of the public health program. Where's Shane? Shane.
He went to go grab.
Y'all ran him so hard. He exited. He's also a graduate. We have some other graduates in the room. So it's a great program, and not because I'm in there, but listen, I make everything